Welcome. We're thrilled you're here joining us for this five-part series on navigating today's healthcare system. This is presented by Ashby Village's Healthy Aging and Elder Action Groups. Today's presentation, Your Rights When Hospitalized and How to Protect Them, will be led by Jodi, Reid, who's the Executive Director of California Alliance for Retired Americans. Many of you are very familiar with Ashby Village. Some may not be. We are a dynamic community of people transforming how we age. We support each other to age wherever we call home. We support each other with self-determination, with dignity and purpose. We have about 450 members, 250 volunteers, and a dedicated network of partners and supporters. If you aren't already, join us as a member, a volunteer, or both. Ashby Village presents these kinds and this quality of programming free of charge, so it's accessible to everyone. If you're able to support our ability to offer free programming, please donate to Ashby Village. Right now, there's a link to donate in the chat. Okay, before I turn it over to Roberta Pressman, who will introduce Ms. Reid, I want to thank Roberta for envisioning and shepherding, along with many volunteers, on Elder Action, this series that's investigating the challenges to our optimal healthcare for us older adults. Roberta is an Ashby Village member and a steadfast leader of our healthy aging and elder action work that improves the state of healthcare for older adults. Okay, Roberta.
Thanks, Bab. Good morning. Welcome everyone to the second of our 5 presentations on navigating today's healthcare. If you missed last week's presentation by Dr. Sophia Chen on the state of geriatric care, you can now access the recording of it on the Ashby Village website. It's a thorough and comprehensive presentation on what we can expect from our current healthcare systems and what is still needed. And I also want to mention that the recording is actually quite a good one, and the rate of speech is a little slower for those of you who are having trouble hearing Dr. Shen last week. At our last presentation, I talked about the challenges older adults face in getting optimal health care, the lack of physicians trained in the treatment of older adults, and the long waits, often to obtain appointments with our doctors, as well as often shorter times with our doctors once we get these appointments. We hope Dr. Chen's talk was informative and helpful, and that you'll access our guide to a successful visit for your doctor, with your doctor, for tips on how to get the most productive visit with your physician despite these challenges. The guide can be accessed online and will be available at our last and in-person meeting on November 12th, along with the forms and cards Ms. Reid will be talking about today. 2 weeks from now on Tuesday, October 15th, our third presentation will feature Dr. Anna Malinow, who will be reporting on the latest threats to traditional Medicare and what you need to know to protect your healthcare benefits. Registration is still open for this event. These 5 presentations that are being offered this fall, as well as the guide to a visit with your physician, are the results of a study group comprised of members of the Ashby Village Health and Wellness Group and Elder Action, who spent the last 12 to 15 months learning more about the state of healthcare for older adults in our local communities. It was a fun and interesting project, and we learned a lot. And through our Elder Action Group, we took actions to support policies and legislation we believe would improve the health and well-being of seniors. I think it's a wonderful example of the opportunities available to our members at our village who want to explore and act on issues we care about. If you're interested in joining us in health and wellness activities and political advocacy, I'd love to hear from you. And Jessica, I believe, is going to put my contact email in the chat. Thank you. Today, we have the privilege of hearing from someone who's been an outstanding advocate for improving the health and well-being of seniors. Jodi Reid, our speaker today, has been working to improve the quality of life for seniors since 2003 as the organizer and executive director of the California Alliance for Retired Americans, known as CARA, a statewide grassroots senior advocacy organization. Before that, she worked on housing and health on the Mercy Housing Rights Committee, Health Access California, and many other advocacy groups for over 25 years. As the representative to CARA from our Elder Action Group, I've personally attended the meetings she held in the East Bay over the last 5 years. As a result, I can testify to what an amazing job she has done to call attention to important legislation and policies affecting our health and welfare, and to organize us to advocate for or work against issues that affect our well-being. Through her work at CARA, she's brought together the most diverse coalition of activists I've ever had the opportunity to work with. People from all walks of life and life experiences who together gave their time and efforts to make things just a little better for older adults and for those who serve them. She's worked with senior activists on housing and health issues, on protecting Medicare and Medicaid benefits, and has trained hundreds of senior activists to engage in local, state, and national issues. It was thanks to Jodi and CARA that we at Ashby Village's task force on healthcare, wishing to support many of these issues, got excellent information and direction in learning how we could, through our Elder Action Group, best take our own actions. I'll let Jodi tell you herself how she got involved with hospital rights. Also an interesting story about how she used even her own personal adversity to be of help to others. It's a pleasure today to welcome Jodi to Ashby Village and to give our members a chance to meet almost in person such a special person. Welcome, Jodi Reid. Take it away.
Thank you so much, Roberta, and excuse my voice. It's a little hoarse. I'll tell you why in a bit. We're very, very grateful to Ashby Village and to Elder Action, who is a part of our coalition. We represent over 350 different organizations around the state who work on and care about improving the quality of life for seniors, people with disabilities, and all of our families. And since we're primarily a grassroots advocacy organization, we often base the issues we work on based on experiences that many of our members share with us. And we created what we call the Empowered Elder Workshops, which this is a part of today, to help people advocate for themselves or their loved ones while we continue to fight to improve some of the situations that people find themselves in and which can be avoided either through individual knowledge and sometimes through legislative action. So today I'm going to focus on your rights in a hospital, but I would be remiss if I didn't start with a tool that we have been sharing across the state to hundreds of thousands of people, and I want to make sure you know about it. We're going to start with what's called the Vial of Life. And this is one thing you and everyone you know and love should take advantage of. All of the materials that we're going to be sharing with you today, they're going to be provided to you by Ashby Village, but they are also on the CARA website, which is www.californiaalliance.org, and under Empowered Elders. And you can print these off yourself. The Vial of Life is a form, it's before you now on Zoom, where you indicate important information that would be helpful, if not necessary, if something were to happen to you in an emergency situation, and whoever finds you in that situation, whether it's an emergency responder, EMT, fire department, what have you, or someone visiting you or a neighbor. And it gives you an opportunity to list your key information about yourself, your health plan, that and Medicare information, who your primary doctor or doctors. Some of us are under the care of more than one physician. Any medical conditions you currently have, any that medications you're taking, and those can be quite extensive. So I often encourage people to just make a list and staple it to this form so that you don't have to try and squeeze it all in there, because some of the names of these medications are impossible to pronounce and long. And like I said, your doctors and your emergency contacts. If something were to happen, who should be contacted to let them know what has happened, if you're being taken to the hospital, which hospital, etc. And any other important instructions that you might have, allergies to medications, etc. And this form gets put in a little Ziploc baggie. This is very, easy to design and easy to make yourself if you don't pick one up. So you can see this handy dandy Ziploc bag. And there are 2 of these red Vial of Life forms in each bag with the form you fill out. One of them goes on your outside door or window or easily noticed location that tells whoever is responding that you have a Vial of Life in your house on your refrigerator. And we encourage you then, the other sticker goes on the outside of this Ziploc bag, and then with the form filled out, you put this on your refrigerator with a magnet or a clip or a piece of tape, whatever works on your refrigerator. And that gives the person responding, whoever it is, the important and critical information that you need. This is the best gift you can give to yourself and to everyone you know. And what I usually do with this is, it's very self-explanatory, but I usually, before I fill it out, I make a couple copies so that if anything should change in my health situation, I can update this. And then once I've filled out the most current information, I make several copies, and I make sure my primary care provider has it on file. My emergency contacts have them, and I make an extra copy. I keep one in my glove compartment of my car. I have one in my purse or whatever I'm carrying, wallet, and then the one on the refrigerator. Because an emergency can happen anywhere. It doesn't always happen right in your home. So the more you've shared this information with your provider and your network, as well as your contacts, the easier it will be for them to do what you ask, and take you to the hospital of your choice or contact your main provider. One year when I first learned about this, I made a bunch of these packets, and as a holiday gift, I sent it to my family, my friends, everybody I knew, so that we could all have this information available for ourselves and our own protection, as well as for those who we care about. And as Roberta mentioned, many years ago, I used to work with Mercy Housing, which builds affordable housing around California, including many affordable units for older adults and people with disabilities. And they started having every resident, as they move in, fill one of these out. They keep it on file in the office of the building so that the staff have it, but everybody else in their individual unit also had it. The fire department created this originally in San Francisco. And now across the country, other fire departments are using a tool. They don't always look like this, but the intent is the same. So I just wanted to start with that so that you would have, if you don't have something like this, consider getting your hands on one of these, either from our website or when you go to your in-person meeting in November, they'll be available for you. Okay. Moving on to the main part of today's training is about your rights in a hospital. And we've been doing this training for many, many years. And we often started with asking people about their own experience, how many people had been in a hospital, what was their experience, what surprised them about being in a hospital that they didn't expect. But since we're on a Zoom, it's harder to do that. So I'm going to use my own personal experience that happened a year ago, actually. I had a heart attack. I'm diabetic. I have been for most of my life, but I don't take any medications, or I didn't. I have dealt with it with diet and exercise. And I didn't have any heart condition that I knew of. But diabetes often is connected to heart issues. And so I found myself in the hospital, first in an emergency room at San Francisco General, and then ultimately I was taken to Kaiser. They put in a stent, and I'm, good as new, except my voice, which is why it's a little, sounds like I have laryngitis. I like to think it sounds like I'm Lauren Bacall, but I don't think that's exactly right. But I was intubated when I passed out, and it scratched my vocal cords. And for a while, I couldn't get any sound out. But now I don't know, this may be what it is for the rest of my life. I don't know. It doesn't hurt. So as long as you can hear me. And I'm going to use a couple of my own experiences in the hospital to highlight some of this. But I want to start by saying, if you have a planned procedure that will require you to go to the hospital for 1 or more days, the most important thing you can do for yourself is find out as much about what you will expect to happen in the hospital before you go to the hospital. So, what do you need to bring with you? How long you might be there? So if you need to arrange for someone to take care of your pets, feed your plants, water your plants, collect your mail, whatever, that you can make those arrangements. Find out how long, generally speaking, you might be in the hospital, what you should bring with you and what you shouldn't. And if you can, find out what the recovery plan is. How long will you need to be recuperating even once you go home? Will you need rehab and go to a facility? Will you need someone to come in and help in some way? As much as you can find out before going in, the better. And I will share a secret, which is not that big of a secret anymore. I am not a big fan of hospitals or doctors. I like them personally, but I've always been kind of freaked out, which is why I've always tried very hard to stay healthy so that I don't have to go very often. And they make me really nervous. So I often try to bring someone with me when I go to the doctor, if there is something wrong that I'm trying to fix, whether it requires hospitalization or not, because I'm so nervous, I forget to ask questions. And I just, I'm just not my most focused self. If you're going in to the doctor to learn about a hospital stay, I encourage you to bring somebody with you. If not, write down your questions before you go, so that if you forget to answer, you'll have something to refer to. So that's the very first thing you can do for yourself, or if you are somebody's caregiver or health advocate, if they can come with you when you're preparing for a hospital stay, I encourage you to bring someone so that you make sure you get all your questions answered before going in. I'm going to focus mostly on what happens once you're in the hospital. So, one of the things, I had never been in the hospital for an overnight stay in my life. I've been really, really lucky. And there have been a couple times when I've had to go to the hospital, but it's been more of a in and out. However, my kids both have had hospital stays, and I learned a lot about hospitals from their experience. And then it kind of came back to me when I was there. So when I wound up in the emergency room, I was out. I had passed out. And I woke up and I was in an ICU at San Francisco General, and I had no idea where I was. I saw these yellow walls. I don't have yellow walls in my house, and they looked like somewhere I'd never been. I thought I was dreaming, only to, when I came to, find out that I had had a heart attack. So fortunately for me, I didn't know. I didn't experience any of the actually falling out. And by the time I woke up, I was, stable. And then I was taken to Kaiser, which is where I have my Senior Advantage plan in San Francisco. And there I was fully awake. And one of the things that was really noticeable was how overworked every single staff person is in a hospital. I talked to the nurses, and I talked to my family, and I talked to the doctor. I was only there 2 days, 1 night. But I was very lucky that I had family members with me almost the entire time. So if I needed something and the nurse or whoever was unable to answer my bell, they could walk out, go to the nurse's station and say, Jodi needs this. Or a lot of people don't have that. And it can be very frustrating if you need to go to the bathroom or you're in pain or whatever. But the nurses are assigned this is again my experience, we're assigned way too many patients, and they kind of have to triage. And I was on the cardiac unit, so obviously they need to go where the most pressing need is. And kind of evaluate that regularly, because they often are short-staffed. The doctors don't come by very often. Maybe they do their rounds once. So it's really the nurses and the aides that you see more frequently. So having somebody there, if at all possible, even if it's for only a few hours, can be really helpful, especially if you're in a situation where you can't get up and speak for yourself as much as you might normally do. But there are some things that seem to have become very common in our healthcare system. So figuring out how to make sure you have an advocate and to advocate for what you need. And being in a hospital is not the time to be shy, because if something is bothering you, you need it to be tended to. That's why you're there. And so I really urge people to put away their shyness and ask for what you need. And if you can get somebody there, please do that. But so let's say, you're in the hospital and you have whatever the procedure is, or, the remedy for your situation has happened, and you're now recuperating. One of the most common problems in hospitals, especially for older people, is that there is a protocol for certain kinds of procedures or health incidents where the hospital system has a usual length of stay for any one procedure. So if you are giving birth, you generally are, encouraged to stay X number of nights unless there was some complication. For for a mastectomy, there's a standard. For heart attacks, depending on what it is and what they've done, there's a standard. The problem is each of us is not a standard. We are our own individual person, and the way we respond to medications, to anesthesia, to pain is different. We're not all the same. So there's the standard practice, and then there's our own individual experience. Often because these hospitals are busy, staffing has been very challenging, especially during COVID and post-COVID, and there is a huge incentive by the hospitals to move people who are in their determination ready to be discharged, either to home or to a rehab facility, as soon as is possible, so that they can free up that bed for the next person who needs care. But often this comes as a detriment to your safety, because the doctor may see that your vitals look normal, but if you are experiencing dizziness or nausea or pain, even if your vitals look okay, you might not be okay to go home. And Medicare, over the many decades since 1965, has experienced a problem where people who are Medicare eligible have been discharged from the hospital with the belief that the doctor and discharging staff have made a informed decision that you are ready to go. And because you've met that protocol, they come in maybe the morning you are being discharged and saying, lucky you, you are going to be going home at noon today, and would you please sign this discharge order? That's usually developed by the doctor, sometimes the nurse. Do you have any questions? And you may feel like, I can't believe they're discharging me because I can't even get out of bed to go to the bathroom by myself without feeling dizzy and like I'm going to fall. And I live alone, or there's no one that's going to be there to help me. And I don't know why they think I'm okay to go home, but I don't think I'm okay to go home. This is one example. And so you say, really, I don't think it's safe for me to go home right now. And the discharge doctor or whomever says, well, everything looks okay to me. And you say, but I don't feel okay. And I don't think it's safe for me to go home because I can't take care of myself. So Medicare found that this happened a lot. And what the result often was is that people would get discharged and wind up having to call 911 and be brought back to the hospital within 30 days or less of being discharged with a complication, a problem, whatever, only to have to be readmitted. And this costs Medicare, which we pay for, obviously, and they are guarantee us to provide coverage for that payment. Medicare winds up paying for a readmission to the hospital that often costs way more than the hospitalization itself, because usually when you're readmitted like this, you go through the emergency room doors, which are twice as expensive, rather than a planned procedure where you're given so many days and the Medicare is just paying for your supervision for those days you stay before being discharged. And so Medicare was finding it was spending a lot of our money on unnecessary readmissions, where if somebody could have stayed one more night, 2 more nights in the hospital, they would have been able to go home having gotten their balance, dealt with the fever or dizziness or whatever, and avoided a readmission. So they created this program called Discharge Appeal, that every single Medicare beneficiary in the country has access to. And this is really important. They pay for a third-party organization. This is paid for by Medicare. And if you or your advocate says, I see you've given us this discharge paper, but we are not ready. I am not ready. I don't think it's safe to go home based on what you've told me. I need a hospital bed. I need my bandages to be replaced and my infection cleaned. I need to eat. I have to go upstairs and I had a hip replacement and I can't walk well yet, let alone go upstairs. Whatever. I'm not ready to go home and haven't been able to make these arrangements to go home. I want to appeal this discharge. And hospitals are supposed to have at every nurse's station a form that's a hospital discharge appeal form. And you are supposed to be able to ask to have that to formally file an appeal. And then that paper, once you've filled it out, explaining why you do not think it's safe to go home, gets faxed to the agency. In California right now, the agency's name is Levanta. That name can change because the Center for Medicare and Medicaid Services re-ups proposals every so many years for an agency to be approved as the agency for your area. So right now the agency is Levanta. The name might change over time when a new agency is approved, but the phone number and the fax number never change. If the hospital says, we don't have those forms, I don't know what you're talking about, which has happened many times, you can call an 800 number and say, I am in the hospital, or my partner or my friend or my cousin is in the hospital, or I'm calling on her behalf. She has been discharged, given a discharge order, but she or he is not ready to go home, and I'd like to appeal. The person on the phone takes down your information, what hospital, your phone number, why you think it's not safe for you to go home, etc. And from that moment, whether you fax a form or you make a phone call, even if it's just leaving a message because you got the voicemail, the discharge stops. And this third-party agency, right now called Levanta, is required to do an investigation, which includes talking to the person who wrote the discharge order to find out why they wrote that and why they think it is safe for you to go home or to a rehab facility if that's the case. And they also have to talk to you again and and get the story, and then they make a third party unbiased determination on whether the discharge should go through or whether you should be allowed to stay. And if all that time you're still in the hospital, Medicare is continuing to pay for your coverage and for your stay and for everything that they do for you while you're in the hospital. So it's not like if you tell the doctor, no, I don't feel ready, I want to appeal this discharge, that they're going to bill you for every minute you stay because you went against the doctor's order. That is not the case. Levanta does the investigation. Now, one thing I've also learned from having done this so many times, hundreds and hundreds of presentations just like this, is the most common day for a discharge is Friday. This is probably common sense to you, but the reason to me was surprising, and now it's not so surprising, but hospitals have less staff over the weekends. Some of the specialty services are not as available because people want to have the weekends off. And so there is this incentive to reduce the number of beds in use on Fridays, because the hospitals know that there's going to be less service available over the weekend. And so they want to send as many people home as they can. But if you are not ready to go home and it's a Friday, this agency still has to do the investigation, and sometimes the doctor that wrote the discharge order is already gone for the weekend and they can't get a hold of them. What does that mean then? You're in the hospital for the rest of the weekend, until they're able to finish the investigation and determine if in fact it is safe for you to be discharged. Often that weekend is just enough time to be able to recuperate more, so that by Monday, for example, you are feeling less pain, feeling less dizzy, feeling less nauseous. Your fever has gone down, whatever the case may be. You've been able to arrange for a hospital bed to be delivered to your home if that's the case, or been able to arrange for someone to come daily and change your bandages or help you with your medication. Sometimes you just need that extra time in order to be safe to go home, and safe is the key word here. So a very quick story. One of our members in San Jose had come to one of these presentations many years ago, and he found himself in the hospital, and it was actually a Friday, and it was a day off. I don't know why. And I was hiking on a mountain, Mount Tam. Some of you know it. You can probably see it from some of your homes. But I had my trusty phone with me, which I always take with me. Often there's no service on the mountain, but whatever, I still carry it. And I got a phone call as I was hiking, and it was this man who was sitting in his hospital gown in a wheelchair on the curb of the hospital. They had discharged him and called a cab to come and pick him up to take him to his home, which was in a single room occupancy hotel in downtown San Jose. He had no restroom in his room. There was a communal one down the hall. There was no kitchen. He usually got his food at the senior center, which is right down the street from where he lived. And he had 104 temperature, yet they were discharging him. And he called me and said, I don't know who to call. I know you told us there's a way to appeal, but I didn't have it. I couldn't remember. And all I could remember was CARA. And I got your number from, directory assistance or whatever. And I called you. I found your number and I got you. What do I do? And I said, hold on, let me see if my phone will work. And I was able to look up the number of Levanta on Google, trusty Google, and I got the number. I had his cell phone number because he called me and it showed up on my phone. And I called them and said, I am calling for someone who is about to be taken to his home in a very unsafe situation, and he'd like to appeal. And this is his phone number. Could you call him right now? And apparently they did. However, I could not get back in touch with him because I called the hospital and they already had on record that he had been discharged. So they couldn't connect me to his room. And then I called his cell phone number and I couldn't get through. It went straight to voicemail. So I left a message. Finally, that was Friday. On Monday, I get a call from him around noon saying, Jodi, I'm home now. They just dropped me off. But the discharge appeal worked perfectly. They wheeled me back into the hospital and they wound up having to keep me there until Monday. By Monday, because they couldn't get a hold of the doctor. By Monday, my temperature was normal. I felt strong enough to go home and be able to walk down the hall to use the restroom and go get my lunch from the senior center. That's all he needed, was those extra days. That just shows you how this can work. So I want everybody to have access to this number for yourself or someone else. And if you could put up the picture of this card, you're all going to get one of these, either in the mail or going to the event that Ashby Village is sponsoring in November. It looks like this, but you're not going to be able to see it. So if we could share the screen of the hospital discharge wallet card. You can also download this from the CARA website and just cut it out. I urge you to have this card in your wallet with you and give one to everybody you know, just like the Vial of Life. It has the phone number right there. And again, even if you are only able to leave a voicemail message, that you have recorded an appeal at the moment you make that call, if the hospital doesn't have the actual form available. And everything stops until this group can investigate. And sometimes they might come back to you and say, everything seems right to me. I think you're going to have to go home today. But many times they give you at least another day or more until you have stabilized enough, until you've been able to arrange for the services that you'll need once you get home, so that you can safely go home. And if you are discharged from the hospital to a skilled nursing facility or rehab center, this still works. If you're discharged from there before you feel that it's safe to go home, you can still appeal, as long as the referral to another facility came from your hospitalization. This appeal procedure still exists. So that's what so please make sure you get yourself one of these, however you do it, printing them off the website or getting one when you go to a Ashby Village event. A couple of other things I want to talk about that I learned in the hospital that are very important, that there isn't a card for, but I want you to be clear of. I will say there is a whole packet of written material that is what I'm talking from. I'm using this as my guide, that you will also have available. So they're like fact sheets. So remember earlier I said that Medicare started this appeal program because people were being readmitted into the hospital and it was costing a lot more money than just having them stay an extra day until they were ready to go home. In the Affordable Care Act that was passed during the Obama administration, they addressed the issue of hospital readmissions because it doesn't just happen to people on Medicare. It happens to anybody who might be discharged too soon. And they created a disincentive for people to send you home before you're ready by creating a fine starting at $10,000 and going up to a hospital. If someone is readmitted within 30 days of being discharged, the hospital gets fined. Hospitals don't want to pay that fine. They think they're right and their doctors are right, and they don't want to have to take on that responsibility. So a new unit was created. It's not official. They rarely tell you about it, but it's called observation. You may have heard about this. And sometimes if you come into the hospital in an emergency situation, and even sometimes when you have an appointment for something, they can put you in what's called observation. And that could be in the emergency ward, it could be in a room But it's what it is they're going to get to you eventually. Some people have been under observation for more than one day. It doesn't mean that they aren't seeing to you, but you have not been formally admitted. And to be formally admitted, you sign a certificate of admission when you go to the hospital, whether it's coming in through a planned procedure or through the emergency room. You also have to sign your waiver of liability to the hospital so that you can't sue them if something were to go wrong. They also want to make sure they have all of your insurance information, if you have it, and your Medicare information so that they get paid. Those papers, they make sure you sign. But if you're put in an observation, they often don't provide you with the certificate of admission. This is my warning. No matter what, you make sure you sign that certificate of admission. And like me, I was out of it when I was taken to the hospital, but I've trained my family and they signed the certificate of admission and required that they be given that on my behalf when I entered San Francisco General, which was my first stop before Kaiser. If somebody is with you, make sure that they sign. Someone should sign, because the certificate of admission proves that you've been admitted to the hospital, and it is the document that Medicare needs in order to pay for all of your hospital care. And if you don't have that, it's possible that Medicare will deny payment and you'll be stuck with the bill. Even though you're a Medicare beneficiary, they need proof that you've been admitted, and observation does not provide the proof because there's no documentation that the hospital has actually taken you in. And so you can walk out with a huge bill, even though you're on Medicare and it should be covered. So one new lesson is to make sure that somebody signs on your behalf that you've been admitted, and don't sign those liability waivers or insurance documents until you sign the certificate of admission. And demand it, because they don't hesitate in giving you those other documents so that they're not liable, or so that they know how to bill and who to bill for the services you receive. So keep the that observation unit in your mind and make sure that you ask for the certificate of admission. We have been trying to pass legislation in California to deal with this whole observation unit boondoggle. And we've done some things, but there's much more to do to make sure people aren't put in this very difficult position, especially when you have health needs that are urgent. You just want to be dealt with, but you don't want the bill, especially if your Medicare is covering it. And then finally, I know I'm close to my time. One more thing, and I learned this directly. I kind of knew about it, but I had never tried it out. So when I went to Kaiser, and they saw a blockage and they immediately put a stent in, and I'm like, hunky dory, except for my voice. But I was brought to a room that already had had a roommate, and she was a woman who lives in Tracy, California, is not a Kaiser member. And she was with her senior center from Tracy doing a walk in Golden Gate Park, a day trip. And she had, passed out, had a heart attack at Golden Gate Park, and the ambulance rushed her to Kaiser, which I didn't know this either, but apparently Northern California Kaiser in San Francisco, the hospital is the #1 hospital for cardiac patients in Northern California. I didn't know that. I just lucky that I happened to be a Kaiser member. But she was brought there, and she had been there a couple of days before I was there. And she had like quadruple bypass, major surgery. And she was going to require rehab stay in rehab, and they were going to take her. Her son was coming to pick her up to take her to a rehab center in Tracy so that the family would be closer to her and be able to visit her, etc. And so the doctor had just given me my discharge order, and I was more than ready to go home. As I said, I'm not a big fan of hospitals. And they brought in with me this little bag of all these new medications. Mind you, I've never taken a medication in my life. And now I had like 6 that I had to take for blood pressure and blah, 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 and, blood thinner, and some of which were going to be permanent parts of my life and others were temporary. And they just handed me a bag of, my first refill and said, you're ready to go, when you are dressed and, the car's here to pick you up. So I'm getting dressed and getting all my stuff together, and my family went to get the car to pick me up. And the same doctor, who was also my roommate's cardiologist, said, I've written your prescription. Where do you normally get your prescriptions? And she said, CVS in Tracy. So he said, I'm going to have my assistant fax this to your pharmacy and have your son pick these up so you'll have them before he comes to get you and take you to the rehab facility. So you'll have, because they don't have a pharmacy at the rehab facility, you have to bring your medications with you. So she gets a call, an hour later, or not an hour, a few minutes later, from her son, saying, I'm here at CVS. One of these prescriptions alone is $1,000. Your health plan, because remember, she's not a Kaiser member, does not cover this medication. And I don't have $1,000. And so she's on the phone talking to her son, and the cardiologist is standing there, and she's relaying this. And because I'm super nosy, I overhear it. And she and I had become friends in the room together. And the doctor says, well, we can't do that. Oh no, she said, well, you're gonna have to figure this out. Maybe someone can loan you the money. And once you're settled, you can call your plan and fight to get them to cover this for you. But I'm sorry, but there's nothing I can do. And I'm like, wait, I have something to say. I said, have you been giving her this medication while she's in the hospital? And the doctor said, well, of course, that's why I'm prescribing it to her, because she needs to take this possibly forever. And I said, well, why don't you give her enough to get her to the rehab with enough time so she can figure this out with her plan? And he's like, well, she's not a Kaiser member. I'm like, but you've been giving this to her and it's going on her Medicare bill. Just give her some more so that she has some leeway. Otherwise, she's not going to be taking the medication, and all your hard work is for nothing. And Medicare will pay for it, just like Medicare is going to pay for all the previous medication you've given her and her triple, quadruple bypass that you did, even though she's not a Kaiser member, blah, blah, blah. And he's like, we've never done that before. So I have my trusty phone, and I went to Medicare.gov, and I looked up hospitalization and pharmaceuticals, and right there in black and white, it said, you can send a patient home with their first refill and put it on, and it will be covered by Medicare, even if the patient is out of network. And I showed it to the doctor, and I said, you just gave me a whole bag of medication that you're sending me home with. And he was like, yeah, but you're a Kaiser member, so we would be providing the medication anyway. And I said, well, for now, she's a Kaiser patient. Anyway, moral of the story, they did it. And she went home, and her name is Anne, and she's now a CARA member, and she's now my new best friend. And when she got to the rehab facility, they started contacting her plan. I can't remember what it was. I think it was Anthem Blue Cross, but I don't quote me on that. But what she was able to do was call the maker of the drug, this very expensive $1,000 per refill drug, and get them They have a hardship program. Many of these pharmaceutical companies, I mean, they should, given how much they overcharge us for their medications, but that's another workshop about prescription drugs. But they have a hardship program. And because her plan denied her access to this drug that was essential for her recovery, they gave her the drugs at a reduced cost so that she could afford to pay for it out of pocket. And so she now is able to get those drugs. Meanwhile, she still has a fight with her own health plan because they don't cover that particular drug. Every plan has a different formulary. So my message about this, just like with observation units, knowing about that, if you wind up in a hospital and whether it's your plan hospital or you're out of network, if there are new prescriptions that you need to take because of your hospitalization, ask the hospital to give you your first refill so that you can take it with you, whether you're going home or going to a rehab facility, so that you have your first batch. And then you can work on finding out if you can get it refilled by your own plan or whatever afterwards. And let the hospital know it will be covered on your Medicare bill. So that it's not coming out of the hospital's pocket because they're always worried about profit. But don't leave the hospital without that first refill, because when you're discharged from the hospital, I mean, the last thing I wanted to do, even though I felt, much better and I still needed to recover, I didn't want to have to go run to the pharmacy, even though I'm a Kaiser member, and fill my prescription. I didn't have to because they gave it to me, but I wasn't up to going to there or to Walgreens or to wherever. I wanted to go home and not have to worry about that. So it gives you a little more time to then, be able to take care of what you need to continue your recovery. So these are some lessons learned, and they are the law. So if ever anybody questions you about your right to a safe discharge, or your right to ask to sign an admission paper, or your right to take home the first round of medications that are prescribed to you because of your hospitalization, those are part of what Medicare covers, and you have every right to them, and you should demand them. So now I will take some questions. I've seen lots of them in the chat, and I think the Ashby Village folks will read the questions to me, and I'll try to answer them if I can.
Thank you very much, Jodi. This was very informative. And yeah, we have quite a few questions, a lot of comments too. And so I start right away. Will my POLST, the physician's orders for life-sustaining treatment, just in case, with a DNR, do not resuscitate, and associated instructions be obeyed by EMT-ish folks? I doubt that. You? Suggestions about what to arrange if I'm correct?
I don't know the answer to that because I've not experienced it, but here's my suggestion about those directives. Staple it to your vial of life form. Just like I had told you, staple your list of prescriptions. If you have a DNR or a pulse or whatever instructions, staple it to your vial of life form and fold it up and put it back into your handy dandy Ziploc bag. That way they have them. Also, I'm a Kaiser member, as I said, and I've done those instructions and they're on my file, in my record with Kaiser. So that if I were to wind up in the hospital like I did, unbeknownst to me, I woke up there. If I was taken to Kaiser right away, that would be in my file. Since I was taken to San Francisco General, but on my, my partner was with me and told them I was a Kaiser member, they contacted Kaiser, San Francisco General, to see if I had any specific directions. So they're responsible for going to my primary, and I do have them on file. So my suggestion is staple it to your vial of life form in case of an emergency. If someone is helping you who is not your normal doctor, they'll at least see you have indicated your preferences. And also make sure you have it on file with your primary care doctor and the hospital network that you are a part of. I can't answer whether the EMT, for example, will follow those in a life or death situation, because I don't know the answer. But it's better to have everything there so that if they wanted to follow them, they had those directions right in front of them.
Somebody else said something about that too. I prefer to put the vial in the bathroom on the inside of the medicine cabinet. That used to be the standard. Can you say anything about that? Or?
Well, yeah. Number one, if you're going to do that, then you have to indicate on the one that you put on your front door. That's where they can find it, because they're not going to know to go to your medicine cabinet unless something instructs them to go there. The standard for the fire departments, and that's why we've adopted it, because if you call 911, that's who responds, either the EMTs through the fire department or the fire department. Their standard is now on your refrigerator door. It used to be that the reason why it's called vial of life is because you used to take this form and roll it up and stick it into a medicine vial, one of those little bottles, and put it in your refrigerator. And that's why it was called vial, because it was in a vial. But they have found, the fire department, that number one, it's hard to go scrimmaging through somebody's refrigerator between all the mustards and ketchups and everything. They were often hard to find. And second, because the information on these forms has gotten much more detailed. Many of us take multiple medications, for example, and so these forms are bigger than they used to be, and they don't fit in one of those little vials anymore. So they switched and encouraged people to put it outside the refrigerator, because that's the way they do their program. So again, it's not wrong to put it inside a medicine cabinet, but you have to indicate. If you're not able to talk, they have to figure out a way to go find this. So you have to say on your sticker where to find it, so that otherwise they won't have it and they won't be able to follow your instructions. One more thing I want to say about that: if you have more than one person in your house, when my kids were still living at home, for example, I took a photo, a picture of each of us, and also put it in this file, because I wanted them to get the correct vial. And we're all different. We have different medications, different health situations. So I didn't want them to take, fortunately my two kids are both boys, so they would have figured it out fairly quickly. But what if it was one of them and not the other? So if you have more than one person who's using a vial of life, as they should, and they're the same sex, put your picture in there so that they know they have the right person when they're caring for you.
There's one question about how to get the vial of life from, you mentioned that at the beginning, but I assume somebody who came later. And
well, if you registered for this event today, I think that Ashby Village is going to try and make the vial of life, the hospital discharge CARA, and the packet of information available. But if you want to go on your own to do it and not wait, I'm putting the website for California Alliance in the chat. And all of this material is on our website, and you can download it.
Very good. How is the vial of life form different from the POLST?
It's not that much different. And like I said, there's many versions of these. Sometimes your doctors give them to you, sometimes senior centers use them and give them to you to use. They all have the same information. So it doesn't matter. If you already have one, you're good. Just make sure that the most important thing is that you are clear about where an emergency responder or a neighbor can find it. But they all have similar information. And we're not marketing this or we just happen to use this form. There are other versions and they have the same information on them.
Somebody asks for resources for folks who don't have family in the area to be advocates.
So anybody can be your advocate. You're a friend, a member of your senior center, if you go to a congregation, someone from your congregation. You don't have to be a relative to be your healthcare advocate. You need to be someone who is willing, who is not afraid to open their mouth. That would be my number one criteria. Someone who's not afraid to ask questions of providers. Many people are very intimidated by doctors and do whatever they say. And I'm not suggesting that the medical profession is not to be respected, but you know yourself better than anybody else. And you should pick someone who you're able to count on to advocate for you, whoever that is. But in case you don't have someone, and I know as we age, many of us are alone, maybe asking a neighbor or, if somebody comes to mow your lawn, I don't know. But that's why these forms are so important, to put as much information as you can, because in case you are alone, you've at least indicated what your contact information is. My dad, who lived in Chicago before he died, and my brother lived in Chicago also, but I was his healthcare advocate. And they would call me when something happened to him, because I have a bigger mouth than my brother. And I do this kind of stuff, so I know the questions to ask. And several times my dad was brought by ambulance to the hospital. And they called me, and I was the one who demanded that they do this or that. They don't have to be right there, but it is good to have somebody who can come and check on you if you're in the hospital. But if none of those are possible, then make sure you fill out these forms, attach your advance directives and your wishes, so that there aren't questions about what you want on the most essential issues. And the doctors are very good at, I would say, at following these if you have them, whether they're on file with your doctor or they're at your house, where they should also be.
So somebody talks about Levanta. My own experience was appealing a discharge for a friend. We called Levanta, left a message, and the friend stayed for another couple of days, and then she was discharged. We never heard from Levanta. And then the same participant says, when you contact Levanta, I recall the hospital saying that if the appeal is denied, one may be liable for hospital costs since the date of the original discharge order. You have any comment on this?
That's not true, and you should fight tooth and nail against that. Because like I said, once you make an appeal, until a decision is made, whether it's 1 day later or 2 hours later, your hospital stay is covered by Medicare. So a lot of doctors, and I'm not blaming them, sometimes it's the hospital administration that requires this. They try to freak you out so you'll follow their hospital guidelines, because the doctors are employed by the hospital, or in my case, Kaiser, but they're hospital doctors. And so the hospital is saying, get them out and do whatever you have to. And sometimes they offer these threats, like you might have to pay. That is not true. And if you get a bill from the hospital after having appealed and maybe the appeal was denied, you go right back to Levanta and they will help make sure that that charge is taken off.
Okay, are all these materials available in other languages?
They're in Spanish on our website, but our website has a button that says translate. And so you can pull down open a document, then press the translate button, and it gives you some choices. I think Chinese, Tagalog, Russian, there's a couple others. And you can click on the language and it'll translate the document, and then you can print it out. So we don't have them pre-translated except Spanish, but there is a way to get them translated using our website.
Somebody asks about the number, I assume the phone number for insurance counseling.
HICAP.
Mm-hmm.
Is that who you were asking for?
I think so, yeah.
Okay. In the materials, you're going to get this number when, and you can download this too. But I don't know how many of you know who the HICAP stands for, Health Insurance Counseling and Advocacy Program. It is a state program funded in part by the federal government and in part by California. And it provides counseling to Medicare, and if you're a dual eligible, Medicare and Medicaid beneficiaries. And that counseling is offered county by county. So the 800 number for California, it's in here, but I'm looking for it. Sorry, I can't look and talk at the same time. If you go to Health Insurance Counseling Advocacy Program, go to look online and type California Health Insurance, it'll give you an 800 number. And it is in this packet you're going to get, but I don't have it in front of me right now. Then when you call, the first thing that they're going to say when they answer is, what county do you live in? And every county has its own HICAP program. Alameda has a really great HICAP program. And it's different from the one in San Francisco. A different agency, usually a nonprofit, runs it. They don't do what I just did for you, this kind of program. What they are really great at, and now's the time, if you want to ask questions about what kind of services and medications one particular health plan offers versus another, they have all the most up-to-date information on every plan that's available in your county. And especially during open enrollment, which is starting in October, when that's the time you can change from one plan to another, they can tell you how they compare in cost and in coverage. And so, for example, if I wanted to leave Kaiser and go to a different plan, I want to make sure that plan covers the medications I am now taking. Or like a woman who I shared the room with at Kaiser, I told her to do that. If she can switch to Kaiser, because there is Kaiser and Tracy, maybe she should consider that so she doesn't have this issue moving forward. But they have all that information, and they are great at helping you decide what is the best coverage for you, given where you live, the providers in the network. I have a doctor that I love, and I want to make sure, even if I change plans, that doctor is in their network. That would be a question I would ask, are my medications covered by their formulary? So HICAP is a place to call about your coverage.
Before I go to the next question, I just wanted to say that there are also quite a few comments and thank yous to you. Want to read one. This is rather personal, so you might know the person. Thank you so much, Jodi, for this presentation. Ruth would be so proud. It's from a participant by the name of Natasha. So,
nice.
And then another one saying, I so appreciate you having shared your experiences and your advice to us. So just in between and before the next question. The next question is, how long should one stay in observation status before being admitted to a hospital?
1 second. As little as possible. Because remember, services provided to you in observation could be billed directly to you. So as soon as you or whoever is with you is able to ask for the certificate of admission, you should do it. If you're able upon walking in the door immediately, and if you're able, don't sign anything else until you sign that. Demand it. But do it as soon as you can, or if you are unable, because obviously you're in the hospital and there's a reason, have somebody else sign for you. Many hospitals will still send the bill to Medicare and then you're gold. But some hospitals just bill you directly and don't even bother to send the bill to Medicare. Because you're in observation and they just want their money. They don't care who's paying for it or if it would cost you a fortune. I have a million stories to tell you about observation, but we don't have time, of people who have gotten caught in this. And like I said, we are trying to change this law. It's ridiculous. And especially for Medicare, because Medicare covers hospital costs. There should be no reason to not admit you because it's covered. The hospitals don't have to worry about not getting paid. Now, for the rest of us, unfortunately, until we have healthcare for all, that's my pitch. I could do a program on that too. You know, some of us don't have any insurance or have very limited insurance with huge deductibles because it's so expensive. Not that Medicare supplemental insurance is not also expensive, but in terms of hospitalization, and you should all know this, if you're on Medicare, Medicare is the primary insurer, and then your supplement covers those things that Medicare doesn't cover, or any out-of-pocket cost, depending on the type of plan you purchase. So, but Medicare Part A and B covers hospitalization, even if you don't have a supplement. So if you're in the hospital, all of the charges should be covered by Medicare. Look, we paid into it all our working lives, and we're still paying into it when retired. It comes directly out of your Social Security check, your portion of the Medicare Part A and B, before they send you your Social Security. So you're still paying for it. So you deserve to get all of the benefits that Medicare provides.
Yeah, there are lots of questions about that observation. I will read this one. If you are under observation and hospital tries to discharge without signing a certificate of admission, how do you not get charged for the observation period in the ER?
Oh boy, that's yeah, I don't know. I mean, that's why you should fight to sign that as soon as possible. I do know, but it has required attorneys. There was one instance that was, it was a head trauma. The person was readmitted into observation after having brain surgery for a tumor. And then the person was sent home before it was safe. And they didn't fight it. And he wound up the next week having fallen and had a brain hemorrhage. And the wife, who's also elderly, you know, she just wanted her husband to be taken care of. 2 weeks later, they got a bill for $750,000 for the second admission that was in observation, and they didn't file that certificate. And they would have had to sell their house. I mean, literally, who has $750,000 handy to pay a hospital bill? And so she wound up paying for an attorney to advocate for her with Medicare and the hospital to get Medicare to cover it. It took 2 years, but she finally got that bill covered by Medicare. You shouldn't have to do that. But that's why, you know, I really encourage folks to get that certificate of admission signed. But, you know, I don't know how easy it would be if you didn't do that and you were in observation and Medicare denied payment for that service. I don't know how successful you will be, but this person was, but it required her hiring an attorney in order to get that bill paid.
Somebody was just asking a question about how to get your form to Levanta, and she said faxing is such an outdated technology. Does that mean only faxing is possible?
Actually, I should have said this. I was just reviewing my notes before this event today, and I went to the Levanta website. Levanta, and then they ask you what state you're in, and it's Livanta. Several people asked, how do you spell it? You're going to get that card, so it's on there. And Levanta covers all of the states in Region 9 of CMS, which we are in California. But when you go to the Levanta website, it asks you what state you're in, and you click California, and they now have an online appeal form. So you could call the 800 number and leave a message if no one answers. You can also file now online, because you're right, faxes are very outdated, and many hospitals say they don't have the form, and so they can't do it anyway. You should, you also now can do online. That's new. That didn't used to be the case. I warn you, phones don't always work so well in the hospital, because they've got all this machinery, and so the reception is sometimes really terrible. So if you're going to do something online, if you have somebody with you, just go outside and have them fill it out, just to make sure that it goes through, because like I said, hospitals jam up, the internet sometimes, not always. So try it, but if it doesn't work, you may have to go outside of the hospital to get service.
Is Levanta nationwide or just California?
No, it's not. It is not nationwide. Other states have other similar programs with a different name, but Levanta is in many, many states. But every state has a program like Levanta, every state. So if something should happen to you, if you're traveling, there is an equivalent organization in every state. I mean, you could also call Levanta because you're a California resident and they could help you. But there are specific organizations in every state.
How can the EMTs get into my house if the door is locked and they cannot open it?
Well, I have heard that, I don't know about the EMTs, but certainly the fire department breaks the lock if an emergency call is given to them. And I want to say this about emergency. This is an issue that we've been able to win, but it's every year. Cell phones, if you call 911 from a cell phone, they may not be able to find the location you're calling from. They don't have the same GPS service that landlines have. And so we have been fighting against AT&T and Verizon, who want to discontinue servicing landlines. And we have fought them at the PUC and at the legislature, and so far we've won, saying until cell phone service has GPS, so that if you use 911, they will be able to find your location and help you. Until that is guaranteed, you cannot get rid of landlines, which for many people is the only way they can get 911 service to their home. So if you call on a landline to 911, your address comes up. And so they will send someone, and if the door's locked, they will break in if necessary. If you have one of those life alert systems and you press it, it will then communicate with 911 on your behalf, which is a reason to have them. I know they're not, the most beautiful jewelry, but I fought with my father for years. I bought him the latest version, and he wouldn't wear it. And I'm like, what do you think? Then you're going to blame us when no one can come to help you if something happens. How do you think we're going to know? And he finally wore it. And thank God he did, because he fell, hit his head, was bleeding, was able to press the button beforehand. Otherwise, he would be still lying there today, possibly. I mean, this was a while ago, so probably not today, but you know, they are there for a reason. So if you have a health issue or if you're alone, don't be ashamed to wear that. It's your quickest way to get help. If something should happen and you're alone and you can't get to the phone, you can just press this button and there you have it. So I really urge people to take advantage of these things, even though you don't want. I mean, I was the last to admit that I swore I was never going to go to the hospital until the day I die. I had no idea I had a heart problem. And I fell out not remembering a thing, thank goodness, and woke up in a hospital. Even the people like me who are so stubborn and think nothing's going to happen to them, stuff happens to you that's beyond your control. And, you know, I have just ordered my life alert. And I got one from my partner too, even though he says, well, I didn't have a heart attack. I'm like, I don't care. You know, I learned my lesson and I'm not ashamed to wear it, and you shouldn't be either.
Yeah, unfortunately, we are out of time. I mean, it's this was really great presentation. Thank you so much, Jodi. And just wanted to say, give you one last comment from one of the participants. This has been a very powerful presentation. Thanks to our presenter and to Roberta. I wanted to say that at the end. I'm sorry I didn't get to all the questions, but I think we answered, or you answered, some of the very important ones, and not that the other ones are not important. And I now give it back to Roberta.
Can I just say one more thing? Because I want to thank you all for doing this. It's really important. I'm happy to do it again. We have other people on staff who also can do this, including Ruth, who was mentioned in your chat. But I also want to tell you that Ashby, the Elder Action Group, is a member of CARA, which means that everybody who's a member of Elder Action is automatically a member of us. And so if you want to get information from us directly, you just need to send us your contact information and we will put you on our list, and you'll get our alerts, you'll get invitations to programs like this. So don't hesitate to reach out to us. If you have further questions, feel free to contact us. That's why we do this. And thank you so much for your attention and for being here today.
Thank you, Jodi. Terrific presentation. I just want to quickly remind everyone that the forms that Jodi was talking about are available through Ashby Village. They're going to be available at our in-person meeting on November 12th, would be the last of our presentations. And yeah, we'll have all the stickers, the Vial of Life, and the Levanta cards available, and they'll be available in the office as well after that. I also want to mention or remind you all about next week's presentation on Medicare with Dr. Anna Malinow. There are a lot of changes going on in Medicare, sometimes stealth changes that affect our benefits, and it will be a very informative presentation, and I hope you will all join us then. And as Bab mentioned earlier, Ashby Village is a nonprofit, and if you've enjoyed our presentations, we would also appreciate any donations that you might like to make to us. We're happy to make these presentations available free of charge to the community, and we rely on donations to bring programs such as this to our members and friends. So thank you so much. And the way to donate is also in our chat. Have a lovely day, everyone, and stay cool.